Hello, and welcome back to Natural Cures Unveiled. Today, we're discussing the top 9 warning signs of blood clots, a topic that's not only important but potentially life-saving. Understanding these symptoms is crucial because while blood clots can be beneficial in stopping bleeding after an injury, they can also pose serious health risks when they form abnormally in blood vessels. Arterial clots can lead to heart attacks or strokes, while venous clots can cause conditions like DVT or PE, which can be life-threatening. So, let's dive into these warning signs for your health and well-being. So what are blood clots? Blood clots are semi-solid masses that form in our blood vessels. They are a natural part of our body's defense mechanism. When we get injured, the body uses blood clots to stop bleeding. This is an essential process in wound healing and preventing excessive blood loss. In other words, blood clots can be beneficial as they help us recover from injuries and surgery. They're like nature's band-aids, sealing off damaged blood vessels and allowing the healing process to begin. But before we get started, a quick reminder, this video is for educational purposes only. Always consult with your healthcare provider if you have any medical concerns or conditions. Top 9 warning signs of blood clots. Now that we understand what blood clots are, let's delve into the top 9 warning signs that you should be aware of. Recognizing these signs early can be a lifesaver. Number 1. Swelling. Sudden and unexplained swelling, especially in the legs or arms, can be a sign of a blood clots. Swelling can be an alarming symptom when it occurs suddenly and without an apparent cause, especially in the legs or arms. Let's delve into why this happens and what it may signify. Swelling is the body's natural response to inflammation or injury. When a blood clot forms in a deep vein, such as those in the legs or arms, it disrupts the normal blood flow in that area. As a result, blood can pool behind the clot, leading to increased pressure in the affected vein. This elevated pressure can cause fluid to leak into the surrounding tissues, leading to swelling. Persistent, unexplained swelling, especially in your legs or arms, could be a sign of a blood clot. This swelling might not get better with rest or elevation. If you also notice warmth, redness, or pain in the area, it's essential to take it seriously. These symptoms together are called the triad of deep vein thrombosis, DVT. Don't ignore it. Seek medical attention promptly to rule out a blood clot, as untreated DVT can lead to serious complications. Your healthcare provider can perform tests to diagnose the issue. Number 2. Pain or discomfort. Another crucial warning sign of a blood clot is pain or discomfort. If you experience persistent pain, tenderness, or aching in a specific area, especially if it's accompanied by warmth and redness, it could be a strong indicator of a clot. This is a signal to take action immediately. When a blood clot forms in a vein, it can create a blockage in the blood flow. This blockage can lead to increased pressure in the affected area, causing pain and discomfort. The pressure buildup can also lead to inflammation, which can manifest as warmth and redness. Persistent pain or discomfort, especially in one specific area, should not be ignored. Blood clots can occur in various body parts, leading to different locations of pain. If you have pain along with warmth, redness, or swelling, seek immediate medical attention. A healthcare provider can diagnose if a blood clot is the cause, recognize and act on persistent pain with other clot-related symptoms to prevent complications. Number 3. Warmth and redness. When it comes to recognizing blood clot warning signs, warmth and redness in a specific area can be telling indicators. Let's explore why the affected area might feel warmer to the touch and appear red or discolored. The presence of warmth and redness is often associated with inflammation, and in the context of blood clots, it's a result of the body's natural response to the clot's presence. When a blood clot forms in a vein, it can obstruct the normal blood flow, causing the blood to pool behind the clot. This accumulation of blood can lead to increased pressure in the vein and trigger an inflammatory response. Inflammation can manifest as warmth to the touch, and the affected area may appear visibly red or discolored due to the dilation of nearby blood vessels. Warmth and redness usually occur where the blood clot is located, such as in the affected leg for a clot in a deep vein. If you have these along with pain, swelling, or discomfort, it's a strong sign of a potential blood clot. If you see warmth and redness in a specific area, especially with other concerning symptoms, Seek immediate medical attention to rule out a blood clot. Number 4. Skin changes. Among the warning signs of blood clots, skin changes such as a rash or bluish tint may not be as immediately noticeable but are equally important to recognize. Let's explore why these subtle changes should not be ignored. Skin changes can manifest in various ways when a blood clot is present in a nearby vein. While these changes can be subtle, they can provide crucial clues about the underlying issue. One notable skin change is the development of a rash. This rash may appear as red or discolored patches on the skin's surface, often in the area close to the clot. Another noteworthy skin change is a bluish tint or discoloration of the skin. This bluish hue, known as cyanosis, occurs when oxygen levels in the blood are reduced due to impaired circulation. These skin changes can occur in the vicinity of the blood clot and are a result of the disruption in normal blood flow and oxygen delivery to the skin tissues. Skin changes like a rash or bluish tint should not be ignored, as they can signal an underlying issue, especially when accompanied by pain, swelling, or discomfort. Consult a healthcare professional when you notice these changes, as they may indicate a blood clot. Early detection and intervention are vital for managing clots and preventing complications. Number 5. Shortness of breath. Shortness of breath occurs when a blood clot, typically formed in the legs or pelvis, a condition known as deep vein thrombosis or DVT, breaks free and travels to the lungs. This condition is called a pulmonary embolism, and it can be life-threatening. The reason for this sudden onset of breathlessness lies in the clot's obstruction of the pulmonary arteries, which carry blood from the heart to the lungs for oxygenation. When a clot lodges in these arteries, it restricts blood flow and oxygen exchange. The result is a rapid reduction in oxygen levels in the bloodstream, leading to shortness of breath and a feeling of suffocation. This is a critical situation that requires immediate medical attention. Sudden difficulty breathing is a medical emergency. Call 911 immediately and inform them about your symptoms, suspecting a pulmonary embolism. Quick action and treatment can save lives. Number 6. Chest pain. When it comes to recognizing blood clot warning signs, chest pain is one that you should never ignore. If you or someone you know experiences severe chest pain, it could be a symptom of a clot in the heart or lungs, and immediate medical attention is crucial. Chest pain can be a frightening and alarming symptom, and its association with blood clots in the heart or lungs is a serious concern. When a clot affects the coronary arteries, the blood vessels that supply the heart, or lodges in the pulmonary arteries, causing a pulmonary embolism, it can lead to chest pain. The pain experienced in these situations can range from sharp and stabbing to a crushing sensation on the chest. It may be accompanied by other symptoms such as shortness of breath, rapid heart rate, or a feeling of impending doom. Chest pain from a clot can harm the heart or lungs. Take severe, unexpected chest pain seriously. It could be life-threatening. If you or someone has chest pain, act fast. Call 911 and mention the symptoms, including the possibility of a clot. Number 7. Coughing blood. Among the warning signs of blood clots, coughing up blood or hemoptysis is a symptom that demands immediate attention. It's a serious sign that should never be ignored, as it could indicate a clot-related issue, and urgent medical help is needed. Hemoptysis occurs when blood from the respiratory system enters the airway and is coughed up. When blood clots are involved, it can be a sign of a potentially life-threatening situation. The presence of blood in the cough can vary in appearance, ranging from streaks of blood to significant amounts. It may be accompanied by other symptoms such as chest pain, shortness of breath, or a persistent cough. Coughing up blood, hemoptysis, can result from pulmonary embolism or lung vessel damage by clots. It's a severe respiratory issue needing immediate medical care. If you or someone coughs up blood, act fast. Call 911 and mention the symptoms, including clot possibility. Hemoptysis is a significant warning sign. Timely care matters. Number 8. Leg cramp. Among the warning signs of blood clots, walking cramps can be a perplexing but critical symptom to recognize. Let's delve into why they happen and what you should do when you experience them. Walking cramps, also known as calf cramps or muscle cramps, can occur when there's a blood clot in the deep veins of the legs. This condition is known as deep vein thrombosis or DVT. So, why do these cramps happen? So, what should you do if you experience walking cramps and suspect a blood clot? First and foremost, don't ignore it. It's crucial to take action promptly by calling emergency. Number 9. Headache and vision changes. When discussing blood clot warning signs, headache and vision changes are symptoms that warrant attention. A severe headache, especially if accompanied by vision changes, can be a warning sign that should not be ignored, as it could indicate a clot affecting blood flow to the brain. The brain requires a steady supply of oxygen and nutrients delivered through the bloodstream. When a clot interferes with this essential blood flow, it can trigger a cascade of symptoms, including severe headaches. The headache associated with a clot affecting blood flow to the brain can be intense and may not respond to typical headache remedies. It's often described as different from usual headaches and may be accompanied by other concerning symptoms. Vision changes, like blurred or double vision, can signal brain blood flow issues from clots. Take a severe, unusual headache with vision changes seriously. It might indicate a clot in cerebral arteries or veins. Get immediate medical help and mention the possibility of a clot-related problem when experiencing this. Remember, while these warning signs can be indicative of blood clots, they can also be caused by other medical conditions. However, it's essential not to dismiss them and consult a healthcare professional if you experience any of these symptoms. If you enjoyed this video and found it helpful, please don't forget to give it a thumbs up, subscribe to our channel, and hit that notification bell so you never miss out on our latest content. Until next time, stay relaxed and stay healthy.